Welcome to the Masters of Today and Tomorrow, MTT, a podcast focused on spreading valuable frameworks and ideas from the Masters of Today to help you become one of the Masters of Tomorrow. I'm your host, Kevin Liu, an aspiring 16-year-old entrepreneur, developer, and modern-day polymath. Today, we'll be having a legendary guest on the show. Patrick Samy is a co-founder and CEO of Span Health, a startup that offers health coaching informed by biometric data from lab work and wearable devices. Patrick started his career as a software engineer by trade. However, after facing his own personal health challenges, he embarked on a journey to understand what data from his wearable devices meant and how to leverage the data to make informed decisions to optimize for his health, well-being, and longevity. His curiosity for biology, superpowered by his background in computer science, helps him lead and take Span to the next level. By enabling everyday athletes to access valuable insights and action items, Span has the potential to impact millions of lives in the months and years to come. Without further ado, let's get started. Cool, sounds good. Thank you so much, Patrick, for coming on the show, and welcome to the Masters of Today and Tomorrow. First, to kick us off, I would love to hear a little bit about you and Span, and just tell us a little bit about yourself.
Yeah, just to get started, thanks for inviting me. It's great to be here. So I'm Patrick. I'm the co-founder and CEO of Span. I'm an engineer by trade who played tennis my whole life. Got my first computer when I was 4 in 1992, and did all the things. Started building stuff very young and loved doing it. So I kept doing it as my day job, and that's still what I'm doing today.
Amazing, that's really cool. So what actually initially got you interested into the realm of like CS, computer science, as well as then actually bringing into the touch of like sort of the biology and health span and different things there?
Yeah, so I guess on one side, what was interesting is, I went through high school and I took advanced math, science stuff in general. So I did biology. I was really curious about the different things I was learning, not really into it as much as today, I think. I just didn't have the same perspective, but I loved some of the things I was learning about how the body works. And ultimately, I think it was not as much the science of computer I was into, but really the ability to build stuff. And so, I had seen that outside of school, just doing my own stuff and building websites and games online and stuff like that. And so I naturally went to engineering school and started studying CS. Did it for 5 years, got a master's degree. I finished at Stanford, where I was doing some security research. And then started working right away at Microsoft in the Skype team, so building communications products, consumer for 3 years. And as you can imagine, like I said, I was also playing tennis on the side and competing. And so when I started my first full-time job, I wasn't competing anymore, and my health and lifestyle completely changed. And so, in a very similar way to what you described just before we started, I think I started changing my lifestyle. I slowly saw that my energy levels and a lot of things on a daily basis weren't optimal. And after 3 years, when I was 29, I repeated a blood test, which I was doing already because, there's a lot of chronic condition in my family. So just keeping on track for these things, basic panel, blood sugar levels, triglycerides, cholesterol, all that stuff. All these numbers were going up. I have now a clear trend over 6 years of, maybe doing one test every 2-3 years. Seeing those numbers clearly go up. The trend was super clear. And so I thought, I'm physically fit from the outside. There's no way you could tell this guy is on the path to have something like prediabetes. I am eating a balanced diet, avoiding processed foods, sodas, snacks, and so on. And on the side, I'm also playing tennis, obviously still for fun, 2-3 hours a week, and maybe going to the gym once a week to be able to get strength and resistance training done. So how is it possible that I'm on the same path? And so, that was really the trigger for me. That's where the interest comes from. It's linking everything that I've learned in biology and neuroscience when I was studying to the ability to build and actually solve problems and the intersection of human health performance, and longevity specifically.
That's amazing, yeah. And I think that this is a great and brilliant time specifically to be in this industry as well, because I can see that we're heading to a world where there's a ton of emerging tech that's popping up as well, artificial intelligence and among different things and cross sections there. And for that to be also able to touch longevity specifically, that there's a superpower, a multiplying effect that you can do there, right? And with that, we're seeing a ton of innovation and influx of startups and super smart people working on super hard problems like that. And I think the question then becomes, I'm curious, like you mentioned that the motivation and how that initially came to be, and then I'm curious then how does that lead into the specific problem? I'm curious, like if could you talk a little bit more about the thing that you guys are trying to solve at Span?
Yeah, and it came very naturally. It wasn't like, oh, we're gonna start a business and it has to be something in health, so let's figure out an idea and then and start it. I was basically trying to look into why my numbers were going up. I thought there must have been something counterintuitive about what I was doing, my diet, my sleep, my exercise. One of these things, or maybe all of them, must have been wrong for the outcome that I wanted to have. And I was adhering to public health recommendations, like I said, balanced diet, exercise. So I was like, okay, this is really strange. Why is that happening? And so my first instinct was, well, if these recommendations that seem to be pretty much, if you go to a doctor right now, that's what they would tell you to do. If that's not working, then let's get some data and see how, when I do these things, diet, sleep, and exercise, some of the markers of metabolic health on one side, so how my body reacts to food and exercise, and then cardiovascular health, so heart rate variability, and then on the other side also sleep and the length of sleep, the deepness, the depth of sleep, and all these different things. How are these things changing when I do what I do on a daily basis and when I start changing things? So can I just basically run experiments and see that data changing? And so I do that for 2-3 months myself. I bought a Neura ring, so one of these rings that measures your sleep. I got an Apple Watch, which I still have, 23andMe DNA test, continuous glucose monitor. I needed to be able to at least have 2 or 3 data points on various areas so that I could really see when I'm doing something, all these different things changing. And my goal was not to understand only one area of my health, but by combining these things, see if I can find the one thing that allows me to improve everything at the same time. And so I did this myself. And in 2 months, I picked up a lot of low-hanging fruits. I think a lot of people who buy those devices today get a lot of value, and that's the reason why they're so popular, because you can actually see the daily changes, and so you can start building up that map in your head very quickly. Oh, when I do this, this seems to be the pattern, and then you repeat it over time, and you're like, okay, every time I drink alcohol at 6 p.m. when I do this, I sleep really badly. So I'm going to try to do this. If I do have alcohol, probably going to limit my intake. If I do have it, maybe I'm going to try before the meal. And then you start, changing your habits and figuring out what works. And I've done all of that, repeated the blood test. I saw some minor improvements, but I felt like I needed more help. And that's really where, the problem of SPAN is. A lot of people have both those devices today. If you look at how long people look their Apple Health data when they get an Apple Watch, so the heart rate and the stuff that the watch will measure, it's about 1 week, and people drop off. And I think the reason is today that the data is not very easy to visualize and it's not accessible. At the same time, even if you had seen the data, after a week, you're like, oh, I've seen the trends, but what does that mean? What's the next step? What should I be doing? And you have no idea. If you go to your primary care physician with this data, they'll probably say, I don't have the time to help you do this. You can pay for a health coach. They're probably quite expensive, and I'm not sure they would work with an Apple Watch. Some of them would do, but it's hard to find them. And then on the other end, you've got the longevity specialists, the sports medicine doctors, the super top guys who work with data all the time. And I went to one of them for a consultation that I paid for. It was super interesting. I learned a lot, but they charge anywhere between 10 and 50K a month to be able to get access to their service on a continuous basis. So that means them and their health coaching team and a bunch of people on a group with you, discussing every day basically what you're doing. Which, I understand it's a super high end service and they spend a lot of time. But my thinking was also maybe the way they're doing things is not efficient enough, and that's maybe the reason why they're doing things in the way they're doing it. And so what I said is basically I reached out to a friend who I knew was a sports longevity enthusiast and also a medical doctor. And so we did this together, and I helped him by saving him time building a spreadsheet with all the data I was pulling from these devices. And, with basic formulas, basically showing him the different metrics, the specific trends he was looking at instead of the raw data, so that he didn't have to take the time to look at the charts and figure out, oh, this is a trend, this is changing that way, that many percent. Basically put all the data in front of him so that at one glance he could say, oh, this is what's happening this week. And with Patrick, we've been doing this sleep experiment where we're trying to adjust his timing, and we can see that's improving his deep sleep, in literally 1 minute. And then he would basically look at that data and say, okay, let's push down on that experiment, double down, maybe do like an hour of meditation before bed and see how that changes. And all these different things. And so we did this with my friend Adam, who's a DMD, for 6 months, dramatically improved every single area of my health, really, energy levels, mental clarity, how the energy in the morning, so how well I slept and how I recovered. Recovery after exercise was big, and the ability to play tennis for an hour at peak heart rate in the last 20 minutes and not feel like I was, dying basically and making a lot of mistakes. So that's, often happen if you start running at maximum speed, you get your maximum heart rate, and then, that becomes really difficult. But you can train your body to push itself and to be able to perform at this peak heart rate. And I think that's one of the things that I probably neglected for a long time that I was able to do with him. And so I repeated the blood test after 3 months. A little bit has changed. I could see a trend. And then at 6 months, because I could see that trend starting, the blood test at 6 months was completely down, back to normal range. So I could see my triglyceride levels and my blood sugar levels completely dipped and went back to optimal range. And so, a number of things that have changed, not just one, on diet, sleep, and exercise. One of the main learnings for me was we're all so different that even though, we all share 99 plus of our DNA, that 1% is still very, very different. And so that means that you could eat a banana right now, and we could put a continuous glucose monitor on you, and you do really well. And I have a banana, I spike, I double the amount of sugar I have in my blood, and it takes me a lot of time to consume it and to use it. And so from that perspective, that means that we have to completely individualize the way we make changes. And so one example for me was I was eating dinner at 8:30, and I was going to bed at 10:30, 11. And so there's not a lot of time, but after dinner, but there's some amount of time. And what Adam saw in the first week of working together is I had random spikes in the middle of the night in my blood sugar levels. And when I exercised in the evening, I also had elevated heart rate that stayed elevated for longer than if I exercised in the morning. And so one of the things that he picked up is that overall I have a slow metabolism, much slower than the average person on the street. And so I need to be able to know that and to mitigate that in different ways. So, for example, the variability, those spikes were lower or almost inexistent if I left 4 to 5 hours before going to bed between dinner. And so what we ended up doing is said, like, the first 2 weeks, just eat at 6 p.m., go to bed at the same time. And basically, when you go back to bed, you're more likely to have baseline levels. And so we'll see how that goes. And so we do this for 3 to 5 days, maybe day 5. The curve went back to completely normal. I had, played with a CGM for 2 months, never seen that trend. It was completely smooth, just going down slightly and up again, like we would expect for a healthy individual. And so that's when I understood, the intuition of someone like Adam, who knows how to work with data and understand what the data means, and how from all the scientific literature that he's read, he's going to say, that trend means you can try this, and it's much more likely to work than if you go on Google and say, oh, I don't understand why my heart rate variability is going up or down. What should I do? And so it's much more accurate to use, obviously, the intuition of a professional to do this. So that's how we got to SPAN, basically. That's the whole experience that I've just shared is what we're doing with SPAN, but in a much more scalable way because we're able to use technology for it.
Okay, damn, that's brilliant. The whole thing around how you went from having to spend like 10 to 15K per month for the whole MD and their whole team of coaches to now being able to leverage the data and be able to track and reverse engineer different things and patterns and trends is really powerful. And I think that's absolutely amazing. So taking a step back for SPAN, I'm very curious. So essentially, if I got it correctly, you guys are you're developing an app, and basically you're pulling data from a bunch of different sources, and you have a coach. And so how does that come together, and like sort of what is the structure of how the user interacts with the platform as well, and how they get on board and stuff?
Yeah, so today you basically request access on the website. You jump on a call with me. I'll tell you based on your goals how we can really help. On people want to focus on sleep. Some people want to focus on exercise. Some people have a very specific thing like energy levels that fluctuate during the day that they want to solve. And then I'll explain how we can solve that problem for them specifically. And so the way it works is I'll onboard you. The program costs $150 a month, so it's still expensive, but a lot more accessible than the kind of stuff that we're talking about with MDs and clinics. And so you'll basically get access to the app. You start there, you set up a lot of things that allow us to understand you a bit better, your weight, height, but also the things you've tried before, the things that are working for you, your habits you can set up on the app. And then with your coach, you'll have a first call and discuss your history and other things that are more qualitative that will basically go back to our research team internally, which includes an MD today focusing on looking at all your historical data and that call that they had with your coach, and really understanding how we can define the 5 experiments that will help your sleep, your diet, your exercise, and the metrics that we hope to improve. And that's basically built on a library of 100 experiments that we've designed from just leading scientific papers that Adam has read and constructed over the course of the last 2 years, and really understanding these are robust enough that we can actually recommend that based on the specific metrics that we are seeing, but also remaining experimental in the approach. So once we've actually given you that report with all the experiments, you can decide with your coach which ones you want to run first. We'll set it up in the app so you have some content and you're guided throughout the process, but we also show you how your data is changing week over week. So you'll see on the home screen a chart with your daily average, but you also see your number for last week. Let's say your heart rate was 65 BPMs. Today it's 60 BPMs. We are on Thursday, and that's my average for the week. I know that I need to be at a deficit of maybe 3% every week to be able to reach my goal at the end of the month. And so that becomes really clear. You see that number. It says -3, and we are on Thursday. I have all the steps I need to be able to do by Sunday to be able to get to my goal. And so you do them, and then we basically validate that. We're not guaranteeing that the experiment will work, but often, we're using that intuition to be able to get there. So we are actually able to measure it. And if it's not working after a week or 2, and we expected to see some data, then we can actually stop and say, look, that thing that you would have found on Google randomly, it's actually not working. And that experiment that we suggested is probably not working either. So we should move on to something else and try, a different kind of experiment if the goal is to reduce your resting heart rate. And so we can do that for all the markers we support. So today we do the Oura Ring, the Whoop Strap, the 8 Sleep tracker for sleep, the Levels CGM, and all the other CGMs on the market. We're working on Garmin and Fitbit and Polar and all the other brands right now. But essentially, all the markers that you can track with these devices today that are very common. And obviously the Apple Watch, I forgot.
Brilliant. Interesting. So I'm curious then, this leads me into my next question. I'm really curious on how you guys picked what you guys measure on a regular basis, and then also in terms of how you actually ended up looking back at your own personal optimization journey, how you settled on what you started to measure on a daily basis, and then how you analyzed and extracted the data from that.
Yeah, so often it's driven by the personal preference of the person and what they want to achieve. So if they want to focus on sleep, they will tend to have a device that measures what they're interested in. So, for example, the Oura Ring seems to be very popular for sleep. It's a great sleep tracker. People who are interested in sleep will have one, and they'll join us. And then they'll be able to track. So it does a lot of things that we look at. But primarily, I would say the stages of your sleep. And so the length of REM and deep sleep indicates how much in the 7 hours of sleep you're getting, you're recovering. And so if that amount is too small, if there's only 30 minutes of recovery sleep out of 8 hours of sleeping, then maybe we want to start focusing on increasing that to an hour or 2. And that's where an MD like Adam would start and say, okay, that's what I've seen could be improved dramatically. And so these are the top 3 things that I know will improve specifically for that specific area. We start the first experiment, we start changing. And so that's completely individualized right now. And it works the same way for people who have a continuous glucose monitor and say, I want to work on my nutrition, and I know that my energy levels are okay in the morning, but then right after lunch, I crash all the time. And so that's giving us an indication that it's not necessarily the food you're having for lunch, it's possible, but it's also throughout the day that you may have some level of insulin resistance or something that we have to address. And so the CGM is a great way to learn that. It's like, how many spikes do you have and how far are they? Is there any insulin resistance, or is it just literally the kind of food you're having for lunch? And so we can learn from all of these things. And so we tend to look at the variability of your glucose levels, the different averages throughout the day, and all these markers that some other companies are now actually building on top. And we're trying to potentially partner with some of them in the future, like NutriSense, Levels, January AI, so that the scores that they're producing we can actually leverage. Because our role is not to improve the Apple Watch or improve that device. It's to really close the loop between having this data and those scores and what you're doing.
That's brilliant. So essentially making the data more actionable. So on the lens of 23andMe, so you mentioned the gene sequencing and having those biomarkers ready and accessible. So essentially when you bring these new clients on or these new people on, do you end up asking them to essentially go and get sort of the gene editing sequencing and then also get them transporting the data over to you? And then does your team analyze that, and how does that workflow go about?
Yeah, there's no requirement today to do it. We've got 50% of users who've got an Oura Ring. We've got about 30% who have the Whoop strap and 20% who have the Apple Watch in terms of the most popular devices. On top, I would say that 20%, so a fourth, have a CGM. And so that's through many different brands and sometimes just buying it off the counter. On the 23andMe DNA, I actually don't know how many have it. I know it's probably about 10 or 15% who've done one in the past. And so what they do is you can also connect the API, the integration on the app directly. So your coaches can see both the health reports that 23andMe will produce and say, they have a selection of statistical markers that they look at to say you're more likely to have this type of condition in the future and all these things that are interesting to look at in the future. But what we'd like to do is actually look at the DNA retrospectively. And so, we'll do an experiment. We'll start learning about how your body behaves on a specific criteria. And then we'll start looking, we've learned this for 2 weeks. And then we'll start looking at the gene variants that in all the scientific evidence have told us something about this. And so that will reinforce whether we're seeing that picture. And the reason is that, your genes don't define you as much as everyone is saying. If you have that gene, you have that behavior, or you have that disease in the future and all these things. There's a layer in between called epigenetics, which is how those genes are expressed. And so you could have that gene, but it could never be expressed throughout your lifetime. And so I think the question is, we don't have the science today to do a test on you right now and say this gene is expressed. It's just way too complex. And so the best way we can do it is actually observe the behavior and then look at the DNA and think, okay, is that expressed? Can we see that that behavior is reflected in the data we can see? It's a tiny fraction. What we're doing today is, span wouldn't be able to exist in 2015, and I think I've tried to start a company similar to this early on. But today it's possible because we have the early markers from devices that measure things that are directionally valid to see how your health is evolving on a day-to-day basis. And so that's only the first step. We have the first iteration of those devices that are accurate enough to see those different changes. In 10 years, I think we will have a lot more markers, a lot more accuracy, and a lot more interesting data points to look at probably for these kind of things.
That's brilliant. On the lens of the future, tell me a little bit about your vision, about sort of the vision for health coaching and the vision for span health in the near future, around like 10, 15 years maybe.
Yeah, so the big challenge for us is to obviously build a strong brand and to grow that brand. So today we do a lot of education. We want to make that science of longevity and health performance more accessible to a lot of people. So we write a ton of content on the blog for free, literally as we're doing the research, because we need to understand something for our members, and our members are asking that question, and we want to write for them. We just publish it on the blog. So if anyone is listening and just passionate about this space, there's a ton of free content on the blog. On the product side, we've got a long way to go. We've got a ton of feedback from the members we have today. We need to be able to make the product better. And then I think we're slowly gearing up for a public launch towards the beginning of next year, probably in January or February. And so that's what we're preparing for internally, to be able to literally sign up from the website and start onboarding and start doing all these experiments with your coaches more quickly. But in the very long term, the goal is to sort of build a data set on a large enough population that we can start making some predictions. Today, the recommendations are based on this algorithm of basically the intuition of Adam and the scientific evidence that is analyzed. And so what we want is to add a layer on top that, using the data set that we have on our members, obviously it's completely anonymized. It's just a library of all these different data points. We don't need to know who people are. We just need to know how the progress of certain markers has evolved based on what they were doing, the different experiments. And so as we can map this, data set over 1,000 members, if you join tomorrow and you say, I want to sleep better, we can have the app tell you have a low REM sleep and deep sleep, but you're sleeping 7 hours. So we're going to stay on 7 hours, and we're going to try to increase that amount of recovery sleep. And the system will predict these are the top 3 best experiments you can do, not just based on that algorithm, but based on the existing historical data. And therefore, it won't look just at that specific data point, but it will look at the context and will say, oh, I can see, it will be a black box. That's what machine learning and AI is. But it will basically say it's your age, your height, your weight, your genes, whatever we don't know about you, everything that's in a system that will allow us to predict that, rather than focusing on that one metric to predict one thing. And so the accuracy of the system will go up dramatically at that point. And so we'll keep the price point of $150 for people who do want the coach. I think it's, a lot of people want the hand-holding and they need it to be able to have the accountability to maintain a change in habits in the long run. But we also want to build a plan that would be more self-driven, maybe for $50 a month, that allows a lot more people to get the same quality of recommendations, which we can't do right now because a lot of these things are manual. But that's the goal, to be able to create that plan.
Okay, that's brilliant. Interesting. So when it comes to measuring the impact that SPAN has on an individual level for each single person that goes through the app, goes through the coaching program, how do you guys measure the delta between where people started and then over a certain period of time? Is it, generally speaking, where you guys do the calculations where it's qualitative or quantitative? Like how does the process go through that lens on, like, is there something that you generate, like a report every quarter or something like that? Like what's the flow there? I'm curious.
Yeah, so we actually generate a report every single time you finish an experiment. So it's usually every 3 weeks. And the goal is to say, this is how your overall health has changed. Right now, it's literally showing the trends in your metrics. So let's say for those 3 weeks, your heart rate has decreased, your HRV is increased, your glucose is stable, and all these things throughout that period of time. And so it tells you basically overall how things have improved. And so there's like sort of a qualitative approach to it, which is the coach asking you how you did. But what we want to do is basically be able to incorporate things that are more qualitative into another score that will basically start to quantify how you felt, so that we can add that to the trend as well. And overall, the goal in the end is to produce a longevity score. We don't have that right now, but that's one of the things we're working on internally, is to say, if optimal health span specifically is diet plus sleep plus exercise at the optimal divided by stress, for example, physical and mental. Is there a way for us to look at all these markers and basically compute that score for you and say, overall we can see your metrics and how they're changing, but this is what we think is the overall score. And it will probably start by being something that's quite equal, and then we'll start thinking, okay, actually the coefficient for heart rate needs to be higher because that's more important for long-term health, and all these things. So we're learning about that, and we're looking at the data set to be able to do that. But that's basically what we're doing. On what we are seeing, we actually have all the data on the sleep scores after 30 days of people being on the program, and we're comparing that to the 30 days before they joined SPAN. And so we see that clear baseline. Basically, they have a slightly changing curve throughout the month, but basically stable in that baseline. And on SPAN, It's flat for the first few days because they're still setting up that consultation, setting up the experiment, getting ready to start it. And then at day number 10, it starts to go up. And at day 20, it's basically at a plus 15% improvement on the sleep score, regardless of what they work on. So that means even though they work on diet or exercise, they see an improvement in their sleep, which is interesting because some people argue that sleep is a good reflection of overall health. And so it could be a way to measure it. But overall, yeah, that's what we're seeing right now. So there's a clear, result for most of the individuals who are joining us after day 20, which is incredible because that's really fast actually to be able to deliver that kind of progress.
Patrick, this is amazing. This is brilliant. I love this. This is super cool. Wow. So then taking a step back. So one thing I've noticed is that a lot of people, like, pre-existently, they kind of already know what they need to do, like just like sleeping well, eating well, and having the good exercise habits and stuff. But we still see these trends where a ton of people are still extremely in these unhealthy habits and in these like sort of loops where they constantly are doing self-destructive behaviors. And if you look at the data, like over 40% of people in US, for example, are obese. Like there's a ton of people that are sleeping less than 6 hours per night every single night, and they're reaching like the extremes where they're having a ton of stress. Everyone's having poor mental health, especially during these pandemic times and stuff. I'm really curious. So, like in your mind, what do you think would be the single like magic wand that you can wave, and then, or even beyond that, what do you think are a series of things that you really want people to start getting ingrained in their mind that could actually inspire habit changes, or even inspire like lifestyle changes on a mass scale? Like, what's your thoughts on trying to implement something like this on like such a large scale, so then overall as a society everyone can be like healthier, everyone can end up living more healthy, happy, and sort of like long lives essentially, and then decrease the strain on the healthcare system, for example?
Yeah, that's interesting. I think if the goal was decrease the strain on the healthcare system, there would be probably a strategy where you look at the things that are costing the most, the highest amount, like diabetes and obesity, especially long-term costs when you're older and start to get the complications. That's, I think, a job that companies like Levels are doing really well with the CGM access for people who are otherwise not diabetic. And so showing that you can measure your metabolic health before you get diabetes is probably the single best thing that someone can do to be able to see their long-term progress. And so, yeah, I mean, I've used CGM before Levels. I love what they're doing. I love the team. They're really impressive. Yeah, A team, nothing to say there. They're really great. But what I would say is, metabolic health is not the only aspect of health. Sleep, like you said, is really important. Exercise as well. It's hard sometimes to quantify these things and to start looking at the data coming from your Apple Watch or your Whoop or your Oura Ring. And so overall, I think, it's not just diabetes and these conditions that are the obvious strains on the system. It's like the overall thing that we're not measuring. We don't even know what cancer is today, or if there's anything that's related to sleep. There's so many things we don't know, but the question is more, can we focus on a long-term marker and see that marker go up? Can we see incremental progress over time? Because if your sleep keeps improving over time, and when you're 60, it's at like the optimal that you could reach, and you maintain that until you're 100, then you can compete in the centenarian Olympics, and you're like 100, and you have this ability to run and to do all these things that people don't necessarily have today when they're 100. And so that's really the goal, is like to live maybe at 100, like if you were 50 or 60, and to be able to expand that quality of life in our existing lifetime, not to necessarily extend life at that point. And so, yeah, for that purpose, I would say, in general, it's not just Levels. Get any sort of data point on the area of your health you're most interested in improving, like I did. So if you're interested in improving sleep, spend a little bit of money, get a Fitbit, or Oura Ring is great. It's so seamless. The battery lasts long. You don't have to think about it. It's a bit more expensive. The Fitbits, have a bit more flexibility in terms of budget. So many devices are available now that measures these different things. Just pick one area that you've neglected maybe in the past and say, okay, I'm going to focus on my sleep fitness and try to improve this. Get an Apple Watch, measure my sleep continuously, start looking at it and think, what does it mean? What are the things I can do? Read the blog, the Span blog, and see what are the different tips that we've seen work in other members that you could try, and all the different things that could improve. I'm convinced that this approach of looking at the data to really inform yourself on how your sleep is affecting your daily performance and your health will allow people to, every single person who does that continuously for a couple of years probably will learn so much about how their sleep is affected by everything they do that they will maintain a good level of sleep for their entire life. And so I think that's probably the single biggest lever right now, is to be able to look at this data and change a few things. And I don't think you can do the same thing by just not getting that device and going on Google and typing best sleeping plan or, top 10 sleep techniques and trying these things. Maybe you are in the 10% of people who luckily will find the one thing that works for them right away, but it's really likely the same way it is for diet or exercise, that those plans are way too one size fits all to really work for you.
Absolutely, I agree. And on the lens of data, is there any data that you currently don't have access to, or technology and innovation doesn't allow us currently to access, that you would really feel like would 10x the game in terms of measuring people's health and then being able to take action and gain insights from the data from that? Is there anything that you currently don't have access to that you really, really want as part of SPAN?
Yeah, that's a really good question. A lot of people asked us that question recently. Someone asked me that question on Twitter. I think I responded with a long list of things, basically. But I think better access to existing data from devices that exist on the market, like some brands of CGMs, for example, have a very closed system. And so integrating with them is not that easy. And actually, their competitors, who unfortunately have a device that may be less user-friendly, are much better having like a proper API. You integrate with them, you get the full data set. You can see like the minute per minute changes in your glucose levels. And so that's really useful for someone to see on a daily basis, but also to share with someone like a coach like us that can really look at this data and give them advice. And so I'd say better access to existing data is something that I would love to see improved. And then other data points, cortisol levels, to see the impact on stress and start looking at how those trends evolve compared to other things you're doing. Things like more valuable metabolic markers like insulin and C-peptide, the things that kind of correlate with glucose, but actually glucose is just a consequence. What you really want to know is how much insulin you produce, or glucagon, or all these things, these hormones basically that are linked to it. I mean, I could come up with a list. I'm sure you guys will find it on Twitter, but there's a number of things that you can measure that could be super interesting.
Well, that's brilliant. Interesting. So then on the lens of like sort of getting access to data and stuff, once you guys already have this repository and have all these data pieces coming in all at once, how do you guys focus? Because I know in this sort of day and age, there's a huge emphasis on privacy, and especially when it comes to health and sort of data specifically related to someone's well-being, and especially their own sort of like biometric data or biomedical data specifically. How do you guys focus on trying to make it as secure as possible directly within your abilities as a team as a whole?
Yeah, so I think number one on security is never make any compromise, I guess, in terms of how you store the data and the quality of the storage systems that you're using. And so for us, we did a little bit of an exploration, but I think the Google platform was probably the best for that kind of thing. And so, they've got a lot of different systems. One of them is offline, so you can actually store data that you're going to use for machine learning, but actually no one can access it, even you. You have to set up, a specific path bridge for you to access the data when you want to build a machine learning algorithm, for example. And so that's one approach. The other one is not storing information that we don't need. So if we are looking at specific genes in your DNA and we've got our tool to analyze that, we only need the outcome. We only need to know what are the factors that we want to be interested in. We don't need to store your genome. And we probably shouldn't. And that's the reason why we do things in that way. We don't store your genome. We just look at the things we're interested in. We delete data as soon as we've run the tool on it, basically. So I think that's pretty much the security approach. On the privacy side and how we deal with the data, we basically agree never to sell it. obviously. That's part of the privacy statement. It's our core belief that we can't sell your data without your consent. And even with your consent, I don't think that's something we want to do. And for research purposes, we want to have that option, but do it with your consent. So for now, the privacy statement and the way we do things does not include that. And we'll probably come to you and say, we're doing this cool study with maybe Stanford, and they're looking at this on wearable data. Would you be interested in participating and give your data to it? And so even Stanford actually has an app where you can share your data for different studies. And so, yeah, I think that's really cool. And I would love to have that opportunity to do that with some of our members, but we have to ask them first. And so that's the way we do it. I think explicit consent every time you do it. I think Steve Jobs said that you need to ask people and ask people repeatedly. And so that's probably the approach that we would take, given how sensitive the data is.
Brilliant. Yeah. That's amazing. I'm glad you have that robust policy and sort of privacy system set in place. Interesting. Cool. And then on the ends of Span as a whole and the direction moving forward, what are some of the core and key roadblocks that you guys are currently grappling with and dealing with that you guys urgently feel like once you get over them will seriously 10x the trajectory of Span as a whole and the impact that you guys will be able to drive?
Very interesting question. Everything. Just to give you an idea, I mean, it can seem that sometimes we've done a lot, or we are doing a lot with all the members we have, but there's only 4 people in the team today. We are doing a ton with a tiny team, and I think that's amazing, but that's probably the number one constraint. And so the 2 different challenges are on one side, on 3 probably actually. Number one is the product. How do we keep building and increase the velocity at which we are answering the problems and solving the problems that our customers have on the app? And then second one is on the dashboard side, for our coaches to be a lot more efficient at the work they do on a daily basis. And it's things that are very simple, like simply automating workflows, like sending messages that are scheduled in the future, and maybe input some parameters and say, we're going to check in with Kevin next week and ask him about his heart rate going down or up based on what the trend is at that point. And so preparing these things and making sure that they have all the time they need to focus on the interaction with the member when they do have a session on chat, for example, is the key improvement that we want to be making. So I'm going to go for 4 in the end, but third one is probably on growth. How do we build a brand that people really love and enjoy interacting with on all the platforms that we are active on? And so, we're doing a lot of things there. I think number one is definitely, doing this podcast and telling the story about Span and telling about what we do, basically, and doing more of this, I think would be great. Also, I think that leads me to number 4, but it's content and writing a ton of content and sharing that, distributing it on platforms where people really enjoy what we're doing. And so that means communities on Reddit, on Facebook groups, where people own these devices and are asking those questions pretty much every day. And then, so on number 4, specifically on the content side, it's not just for marketing, it's for the sake of making the science more accessible to a larger number of people. And so that's why the articles are very readable, even though we're talking about deep science that are, it's not like things that were published this year, but it's definitely last 5 to 10 years. And so a lot of these things are not up to date right now. And if you Google an article on sleep, you'd find something on WebMD or Healthline that's kind of a short summary, not going into the science, not very easy to understand yourself. So this is the kind of stuff we don't want to do, and want to make sure that we are building this accessible content platform. So yeah, that's probably challenge number 4 is scaling that, having better team of people we can work with, science editors, doctors, researchers who want to write for us and help us on that mission.
Sounds amazing. Really, really cool. Really cool. And then on the ends of something that you talked about earlier in this answer to the question, you were mentioning like different lessons that you've actually gathered or learned, like on the larger scale, and even just like zooming out a little bit. What over the many years that you guys been working on Span and building this out, what are some other key, like really, really valuable lessons and things that you might have not realized was like, it was like a huge light bulb moment that looking back was just like a game changer that you feel like the audience could really benefit from?
That's a really good question. I guess on the path that we took, like we started early on by, I think, automating away too many recommendations and interactions on the chat. And I think we realized at some point that only a high touch human experience was that was the only way basically to solve that problem in a way that's meaningful, where, first there's defensibility. So, someone else that starts a company tomorrow couldn't do the same thing, but also that we build a product that really makes a difference. And so if anyone can build it, that, is it really the best thing for us to be focusing 5-10 years of our life on this? And so I think the goal was really to slightly change the model and understand if people are willing to pay for this sort of more premium engagement service. And as soon as we saw that people were already ready to pay for that amount, and they were maybe already paying for that amount for a personal trainer, a health coach, a gym, and super high-end stuff, we jumped on the opportunity and we started testing that model. And we saw that people were actually much more engaged and they loved that experience. So I think, understanding the perceived value of what we're trying to offer and really exploring the price that people are willing to pay for that sort of value is really important. Otherwise, you could say, you could sell what we're doing for $10 a month. But the problem is, if you put that online and start sharing it with a bunch of people, they'll probably think $10 a month, it's not exactly what I'm looking for. It sounds too low for the kind of help they're doing. So it must be very diluted advice. And it doesn't fit what Span is doing. We're saying we're ultra personalized, looking at your data and all these things. So it just doesn't fit the price today. And so I think that you have to have that understanding about the market, and just no other way than going on calls with customers. And I've done, since we started pivoting to this, I've done 350 calls from March to now. So that's the best way to learn from your potential customers.
That's absolutely brilliant. I love that. I love the sort of takeaways and sort of amazing lessons that you've touched on there. Really, really cool. Sick. Sounds good. So, and then directly on the ends of like user interviews and having these conversations with your customers and really understanding and getting into their pain points and stuff. I'm curious then, directly pivoting, because you mentioned the fact that people were literally ready and they were going to jump on the fact that they were willing to just directly come on and request, and you have like a long wait list essentially where people are wanting to get in, and you're just having the capacity where you're just trying to let people in and trying to develop a very high quality experience for each of them. So I'm curious, what was that sort of customer acquisition pipeline, if you're cool with sharing, and it's also, I'm really curious as well, like, because I noticed that you actually added me to the sort of beta testing and early access email pipeline as well. So I think that's really cool. I'm really curious, like, to see the operations on a larger scale of how you guys operate within the business and how you guys onboard new clients and customers, and then also the back end behind that. It's really cool.
Yeah. So when you sign up for one of these calls on the onboarding email, you basically get on a call with me, and I start pitching you the business. We've got Guy on the team who's also helping me with those calls. And the goal is really to explain the full value proposition of Span. And the reason is that I don't think we know enough today to just put that behind, especially at $150 a month, to put that behind a web page and to ask you to pay right away. And so we need to be able to have that in-depth conversation with you, understand what you're trying to achieve with your health, what are your goals, what podcasts you listen to, what sort of level of education you have when it comes to health and longevity, and what you tried in the past, to then pitch you, this is really how Span can help, and why this ultra personalized and data-driven aspect of the approach will help you compared to maybe what you've tried in the past. Even though you may have seen some success, we can 10x that pretty quickly by following this approach. And so once you're on that call, we basically start onboarding you, and then I pass on to a coach. And so we start onboarding right away, doing the history and so on, to be able to set up the app. And then everything else happens on the weekly reviews that the coaches would do with the customers. And so, that's where a lot of things are half in our dashboard and half on Notion today. And so we want to be able to automate some of these things a lot more and put them in a very structured workflow. So, when you're thinking about, I agreed that I would check in with Kevin on Sunday about this specifically. Can I schedule that message and basically plan all these things? We're working on Kevin's heart rate and trying to lower that. If I see any meaningful changes in the variations in the trends, I can get a notification as a coach, and then I can actually coach Kevin rather than every day for 10 minutes looking at Kevin's data and then looking at the next member's data and so on to figure out what's happening. And so all these things are, operational things are very manual that we are automating at the moment.
Sick. Yeah. Cool. Sounds good. Where do your customers usually live, and where does those sources of these customers come from, generally speaking? Is it generally speaking where you've realized either like Facebook groups or like different Reddit forums and stuff like that? Or where does your market of customers usually live, and where do you tap into that usually?
Yeah, so different communities. The ones you mentioned, Twitter is really big. In the like this crowd of longevity and people who think about metabolic health and try different things, all the self-experimenters basically tend to be very active on Twitter. And so, like people who listen to Joe Rogan and Tim Ferriss and all these guys, they're often very active on Twitter. And so, a big part of our strategy in terms of how we distribute the content, how we also build a community of people who are interested in the space and could potentially like engaging with a brand like Span, and ourselves as founders and as people who are also completely deeply nerdy about the space. It's probably the best place, Twitter, right now.
I love that. Cool. Sounds good. And then the next question within the customers and acquisition and stuff like that, is it harder for you guys to actually sort of like retain customers, or is it harder for you guys to acquire them? Like, what's the sort of framework there?
I would say it's the two, but the caveat is it's harder to acquire the right customer. When you have the right customer, it's not hard to retain them because the product is working, and so it's delivering what they need, and so they stay. But the wrong customer can sign up and then realize it's not for them, and so we're still in that learning process of really understanding who would be interested in that product in the long term and how can we best support the other people who maybe are looking for a more time-boxed experience and then lower experience, maybe a maintenance plan in the future. But for now, our focus is on delighting those customers who are on that plan, to be able to make the products even 10 times better than it is today, to solve even more problems and feel like this is the home screen for their daily health habits that they can look at on a daily basis to understand how their health is changing and what they're doing on a daily basis to be able to improve it.
Cool, sick. And then we're nearing an end, and essentially I wanted to ask, like, what on a day-to-day basis, what does your role actually look like at Span? And I'm pretty sure like you are definitely juggling a bunch of different things and you have your tens and everything, but I'm really curious, like what does your day-to-day routine look like in general as well?
So waking up, trying to wake up as early as possible, but not too early, getting my 7:30, 8 hours of sleep and making sure that I get as much REM and deep sleep and that the quality of the sleep is good. I usually do yoga for like 10-15 minutes, something short, but just like to get my body moving. I've started actually doing that in the light, so being literally just in front of my living room window so that I get as much light as possible first time in the day to kind of set my circadian rhythm. Then I do emails for about 30-45 minutes, and I would basically not necessarily respond to all the emails, but basically schedule them and sort them so I know where to find them and what to do during the day and all these things. And then I usually start my customer calls at this point. So throughout the day, I would have multiple customer calls, maximum 8. And the goal is to obviously pitch them Span and explain the value proposition and then onboard them. And then when I'm not doing that, when I have gaps, basically I have other types of calls. So at the moment, for example, it's with investors. We're raising a seed round. So the goal is to talk to as many investors who could be interested. It's not the best time of the year. It will definitely pick up in September, but we're still having some conversations, so it's good. And then when it's not that, it's on the product design, and product design means listening to the customer's feedback. And so that going to our coach, going to the dashboard where we have all communication with our users and pick up all the things that are interesting feedback that we could implement in the roadmap, update that roadmap and make sure these things are up to speed. and then doing the actual design and implementation for the product. So basically coding, designing at the same time. I barely do mockups. At this point, we need to go so quickly that it's just better to go from my mind to the code, and so and do more iterations on the code to get the final design. So that's kind of the approach here, which saves a lot of time. But obviously, as we're getting to increasing the size of the team, maybe having a designer or multiple engineers on the team, we'll have to start structuring.
That sounds amazing. I love that. Cool. And then really quickly, is there any other sort of last questions that you really wish that I had asked, or any things that you want to touch upon?
No, I mean, that was a really good set of questions, actually.
Sounds good. Cool. And then to wrap this up, finally, I actually like to do a really quick fire series with a few last questions. So to wrap it up, I'm curious. So 5 questions, actually. So the first one is, what are some of your favorite books, and what are some of the thought leaders that you actually look up to in any of the spaces that you're into?
Yeah, really good question. There's a number of people. There's kind of there's 2 books I have in mind right now. One of them is Meditations by Marcus Aurelius. I feel like it's more like a bedside table book that you can open at whatever page you want and then find something really useful for whatever you had as a challenge the current day. For some reason, it's just like really insightful, and I love the general philosophy of Stoicism and so on. Rules by Radicals from Sorellius, who's written this book as a community organizer for Black communities a long time ago in the US. The foundational book for Obama, the book that really got him interested in like community organizing and obviously politics later down the line, but all these things. That's probably the 2 books I'm thinking of. And then I listen to a lot of podcasts, and so I would actually add Peter Attia to the list, who's a medical doctor, surgeon trained at Stanford, who finished medical school, but actually dropped off medicine and worked as a consultant for a number of years until he had his own personal story and ended up going back to medicine, but not doing surgery or any of these things, focusing on longevity and performance or long-term performance. How do you make your body perform at maximum potential for as long as possible?
That's amazing. Cool. And then the third question is, what does your morning, I know you walked through your morning routine really quickly earlier, but what does your night routine sort of wrap up look like, generally speaking?
Yeah, so a lot of the things I do for sleeping and for nighttime are actually during the day. I try to avoid coffee after 12, 1 p.m. So that I've really processed it throughout the day. Right now, I'm doing the experiment of taking magnesium every night at around 8 p.m., 8, 9, just after dinner. Having dinner quite early. I've moved all my heavy meals to lunch, and I'm having lighter meals for dinner. I've been doing that for a long time, and that seems to be a consistent thing that improves my sleep quality. And then trying as much as possible to wind off before bed. It's easier when I have like a set schedule, but when you're raising money, especially at this stage of the business, you're doing the investor calls and all these things on top of your daily job, and so there's so many things, emails that pop up at any time that you kind of have to do it even late in the day. But I'd love to go back to that. So that's what I'm trying to aim for. I think the most important thing is definitely consistency. And so one of the things that the Span app provides is the ability to track that daily schedule. If you drop off because you go on holidays or you come back, you get back to that consistency. And I think that's what's more important than what the actual routine is to have these things, to test them, and to keep improving them over
Amazing.
time.
All the power to you, man. Appreciate it. It's good. And then on the 4th question, actually, what are some of the tools that you use to get things done on a regular basis, and how do you optimize for productivity? I know you mentioned Notion. I love Notion personally, but what are some other tools that you guys use to run the business as well as your personal life as well?
So we use Slack. We use Notion for documentation. I use Loom a lot, and I think some of the members on the team like it. I think it's cool because it's kind of, especially for meeting notes, like meeting notes in Notion, it's useful, but it's hard to do because you don't want to be typing during the meeting. You want to be focusing on what they're saying, and sometimes I take physical notes because it's easier to write like just some keywords than on the computer, and they can hear you type as well. So I tend to do like a short call, or maybe just a short 5-10 minutes Loom video after a meeting where I think I want to share with the team what I've learned, what the person said, any feedback, and all these things. And I'm trying to do it more often right now. It's almost like a small memo for a meeting. And I like the fact that it's video, or even just audio, the fact that it's not just text. And for things that actually need to be documented in a long-term way, because it's useful for us, it's useful when I forget, when someone else in the team will forget about why we made that product decision, it's useful to have it there on Notion and written. And I think, that's the reason why I think we write some of the stuff more long term. In terms of tools, I think that's pretty much it. Other tech stuff for the website and so on, but analytics and things that people
cool stuff. And then lastly, where can people find you online as well as Span, your personal channels as well?
Yeah, Twitter. My handle is Patrick Samy in one word, SAMY. Otherwise, you can find me on LinkedIn. I'm less and less active on LinkedIn. I think it depends on what you're doing. Like when you're starting to hire and you put an advert, I get spammed by recruiters all the time now. So LinkedIn is not an enjoyable experience right now. But yeah, Twitter is the best place. I have my DMs open, I think. So I respond pretty quickly, and I love to hear from people who are excited about what we're doing or just want to share something, or sometimes I try to help as much as I can if I have some free time, which probably isn't the case in the next 2 weeks, but maybe after. I try to give some time for people who are, want to ask me anything and see if I can help anyway, or just connect them with the people that I know can help.
Sounds amazing. That's great to hear. Thank you so much for your time. And I guess that wraps it up basically for today's show. Really appreciate it. And thank you so much for coming on once again.
Yeah, thank you so much for having me.
So check Patrick Samy's, all of his links. I'll post them in the show notes as well. That basically wraps it up for today. And please also feel free to visit Span's website at span.health. Thank you so much for tuning in to today's episode on the Masters of Today and Tomorrow podcast. At the end of the day, without all of you listening in, there would be no show, and I really, really appreciate it. Since you stuck to the very end, I just have 3 more things that you might actually be interested in. First of all, if you enjoyed the show, make sure you go on to Apple Podcasts and leave a comment or review directly with your thoughts to let me know what you're thinking. Next, if you know anyone else that might benefit from the show, shoot them a message and share this episode with them. Feel free to also comment or post your top key takeaways on Instagram, Facebook, or Twitter with the hashtag #MasterInTheMaking. And lastly, for access to all the links, episodes, and additional show notes, make sure you visit our website at www.mtt.world. We might also have some additional goodies there as well, so I'll see you there. Until next time, stay safe and keep working on yourself to become one of the masters of tomorrow.